Welcome to Careful Considerations, an Advent calendar for extended and dementia care planning. My name is Dan Altmeyer, and today is day 17. If you can believe it, we're already to day 17 on our calendar. And today we're going to talk about Medicare and Medicaid, how they're different, how they can help, and maybe what they can't do and can't provide for you. So let's talk a little bit about that. Medicare is a federal government program that was introduced in 1965. If you're 65 or older, you have to register for Medicare, at least Part A. And prior to age 65, some people can qualify if they're on Social Security disability. It's designed to get you better. It's designed for rehabilitation. It's designed for medical plan. It is not designed for chronic and custodial care. Okay, it's not designed really to provide the level of care needed for Parkinson's, Alzheimer's, stroke, or chronic arthritis or other types of chronic diseases. Medicare will pay for primary skilled care or rehabilitative short-term care for up to 100 days in a skilled facility. Now, that doesn't mean you're going to automatically get 100 days if you get to a certain point, especially in rehabilitative care, where you're not showing progress. Then they reassess and will move you on to whatever other levels of care that you may have available in your planning or other programs that may be out there for you. But it is specifically designed to get you better to a point, the point where you can continue to show improvement up to 100 days. There is some home care available, but the home care is limited. It has to be ordered by a physician. You have to be homebound to receive that coverage. And care has to be delivered by a licensed professional, like a registered nurse, a physical therapist, or an occupational therapist. So Medicare is designed for the medical parts of an event. Now, for dementia, it will, if you're in a home-based situation, it will pay for doctor visits that you go to the doctor. It will pay, in most cases, for tests and things like that, but it won't pay for custodial or extended care in those situations. Now, that's Medicare. Medicaid is different. Medicaid is a joint state and federal program. And because of that, it's a little bit different in a lot of different states. So there are certain parts, there are certain states that have different waivers and different programs. So I can't speak to every one of those programs here in our few minutes together. That is part of the planning process, looking at what it is in your situation. But what I can tell you is that typically the care provided by Medicaid for a long-term care event is in a nursing home only. The nursing home has to be a Medicaid licensed facility. The room is usually a semi-private room, usually two persons per room, maybe three, I don't know. And there has to be a Medicaid bed available. So there may be a facility that's right around the corner from your family, but you might not be able to stay there because they might not have a Medicaid bed available. So you may have to go further away, maybe a lot further away, to find a facility with an eligible Medicaid bed available. Now, Medicaid is a specific program that is designed for people of lesser means. So it's important to realize that it's means tested, meaning that it takes into account an individual's income and their assets. To qualify for Medicaid coverage for long-term care, individuals have to meet that specific financial criteria. We'll talk some more about that tomorrow in day 18 when we talk about Medicaid planning. But it is important to realize that Medicaid is available on a means tested basis, which means that there are some limitations on who can qualify. And we'll talk about that in more detail tomorrow. So for today, I want to thank you for your time. I want to thank you for coming in. Just remember, Medicare is about getting you better. Up to 100 days in skilled facilities. Medicaid is there and means tested as a fallback for people who need long-term care and have their assets have been limited. So thank you for your time today, and enjoy your Advent day. And we will see you again tomorrow on day 18 of Careful Considerations, an Advent calendar for extended and dementia care. Bye-bye.